Hi, this is Mark Schroeder with GSHC Surrogacy Agency, and today I'm speaking with Dr. Lisa Becht from HRC Fertility. How are you, Lisa?
I'm doing well today. Thank you so much for inviting me to speak about egg donors.
Absolutely. Thank you very much for giving us your information and your knowledge.
Well, I'd love to introduce myself a little bit more. So my name is Dr. Lisa Becht. I'm a double board certified reproductive endocrinology and infertility doctor here at HRC Fertility. At HRC Fertility, we are in Southern California. We have a couple of different regions, but I am in the Newport Beach office of the Orange County region. And so we work with a lot of different egg donors. So definitely I'm excited to go through all the different questions. So hopefully you can get a little more information to feel more comfortable with considering the process.
Dr. Becht, what medical procedures are involved in the egg donation process?
So in terms of the procedures, it does involve some ultrasounds and blood work, which are very minimal, kind of very low level types of procedures. When we talk about the procedure of an egg retrieval, that's really the main thing that you'll be doing to get the eggs out of your body. So that is a procedure that we do in a surgery center, though really I would still call it a procedure, not surgery. It's about 10 to 15 minutes, depending on how many eggs we're taking out. It's all done what we call transvaginally, meaning that we use a transvaginal ultrasound to be able to see your ovaries. And we have a very small needle that's going to go right through the vaginal wall into the ovary to pull the fluid with the eggs out from both sides. Luckily, you will be sleeping with a deep sedation through anesthesia for this time period. The anesthesia itself, it will put you to sleep. You won't remember anything, won't be any pain, but you won't have a breathing tube and you won't have your muscles frozen. So it's a very quick on and off type of anesthesia. You're going to wake up a few minutes after we're done. And after that, you probably will have a little bit of cramping and bleeding, but probably about 45 minutes to an hour later, you're ready to actually go home. And then in terms of recovery from this procedure, really most women are back to pretty normal activities the next day. You will probably have some bloating for a good few days afterwards, but within about a week, you should feel totally back to normal. And by the time you get your period, about a week and a half later, most women report being totally back to their normal selves.
And how long does the egg donation process take, start to finish?
So start to finish, it could potentially be a couple of months, but in terms of the actual process itself, the first kind of month or two is really going through a screening. So first you're going to go through kind of the agency, or be answering a lot of different questions about your medical history, family history, different types of things like that. If you are kind of marked to be a qualified donor, at that point you're actually going to come in for testing. And so the testing involves a history from a doctor or nurse practitioner. And then we will go through a bunch of different blood work and ultrasounds to make sure that you're really a good candidate to be an egg donor. We're making sure that you have good fertility yourself. At that time period, you're going to be able to answer kind of a lot of questions for us, and we're going to be able to answer a lot of questions for you so we can make sure that you feel comfortable with doing the procedure. We're going to do a lot of paperwork at that point. We'll do consent forms. So that's all kind of one day that you're coming in to do all of that. And then at that point, with a period, in a month that you're ready and it works with your schedule, it's about a month where you're actually going to be doing kind of more of the process of the egg donation. So typically for most donors, we might start with a little bit of birth control. That might go for a couple of weeks. And then the really kind of specific part of the process is about 2 weeks. During those 2 weeks, we will be doing ultrasounds and blood work every couple of mornings. And during that time period for about 10 to 12 days, you're going to be doing injections of medications every night. We will go through how to do that and teach you all of that. And at the very end of it, it's going to end with an egg retrieval. So it could be a couple of months from the very start of the day you decide you might want to donate your eggs to the day we take your eggs out. But the actual kind of really kind of big process where we need you here in the office is just that 1 day of screening, and then about a month of which the first couple weeks are pretty easy, and then the last 2 weeks are going to be a little bit more intensive with being here.
And are there any possible risks or side effects to egg donation?
So that's a great question. So definitely a really common question. So I'll separate them out. So the first thing is the side effects. So in terms of the process, we are having you take hormones to try to get many eggs in your ovaries to grow. In doing that, you probably will feel some side effects. So with the first part of increasing your hormones, usually it's maybe some minor headaches, maybe some mood changes, hopefully nothing major. Usually within a couple of days, those go away, and you have another couple of days where hopefully you don't have major side effects. And then at the end, that's where you're going to feel more like pressure and bloating and cramping. Additionally, from the injections of the hormones themselves, you might have a little bit of bruising, maybe a little bit of pain. But for the most part, most people actually look back on the process and say the side effects were less than they thought. In terms of side effects from the egg retrieval itself, definitely when you wake up, you will have a little bit of cramping and bleeding, maybe for up to a day. And then probably the bigger side effect is bloating for a good couple of days after the procedure. We will do our best to try to keep those side effects to a minimum by watching you closely and changing around your medication doses as needed. And we'll also give you some things you can do prophylactically, meaning you can start electrolytes, stool softeners, all sorts of things to hopefully make you feel a little better in the end. So really side effect wise, there are some side effects, but definitely I would say for the most part, very manageable. Some people come in asking about a potential side effect called ovarian hyperstimulation syndrome, or OHSS. That is something where when you get many, many eggs, which is possible as an egg donor, you have a little bit higher level of these symptoms. Really nowadays with kind of better medications, including what's called a Lupron trigger shot, we really try to decrease these side effects. So if you're ever on Google or social media, kind of the days in which, for example, an egg donor would end up in the hospital from such severe side effects are very, very extremely rare. Just because we're watching you so closely, we use a special trigger shot and sometimes other medications to keep your body from over-responding too much. So those are really the major side effects. In terms of kind of the risks, so in terms of risk, the actual egg retrieval itself, it is technically a procedure and you do get that deep sedation with an anesthesiologist. Anesthesia risk is less than 1% for well-selected patients, which is what we'll make sure as an egg donor that you are. Other potential risks would just be potential increased bleeding, an infection, major kind of trauma to the intestines or the bladder. Those are all extremely rare, less than 1%. Again, in an egg donor population, we are making sure that it is a safe procedure for you. So extremely rare to have any of those. In terms of potential long-term risks, a lot of egg donors and patients want to know about all the hormones that you're taking. So the hormones themselves are pretty much your natural hormones, just at higher levels. And so really in general, we have not found any increased risk of things like cancer. There are specific groups of women that at just baseline are already at a slightly higher risk. For example, if you yourself carried a breast cancer gene, or you have really severe endometriosis, you are already at a little higher risk for certain types of cancer. Typically, we would not be advising you to be an egg donor. Those very specific small groups of women might be at slightly higher risk by taking the medications because they already baseline at that higher risk. But for egg donors, we have found that you can do up to 6 cycles and it does not increase your risk of cancers like breast cancer. And then the last big risk people will ask about will be, does it affect your actual future fertility? And the great answer is no, it does not.
Dr. Beck, can you explain what AMH and follicle count are?
Sure. So AMH, or otherwise known as anti-Müllerian hormone, is a hormone that actually comes from the eggs. So as embryos ourselves in our mom's wombs, we have all of the eggs that we will ever have in our own ovaries. And as we go through life, that number of eggs, unfortunately, just goes down over time, as well as their quality. So AMH is a way of kind of measuring our egg kind of count, if you would like to put it that way. So AMH starts off high, in our 20s, and just unfortunately, as we get older, it does go down. So by measuring your specific AMH, we can get a little better sense as to what number, kind of how good of the quantitative value of your ovaries with your eggs is your specific count right now. Typically, for someone who would be a good candidate as an egg donor, you have a high AMH. And so by getting that, we have a little better sense as to kind of numbers. It doesn't tell us quality, but again, as an egg donor, typically in her 20s or maybe low 30s, we expect good quality. The follicle count is a way to actually numerically guess how many eggs we might be able to get out of the ovaries in 1 month. So that is typically done the first couple of days of your cycle. It is typically done as a transvaginal ultrasound because that's how we can see the follicles. Follicles are little black circles on ultrasound. Each one should probably contain a microscopic egg. And again, by counting them, we can get a better sense kind of how many eggs are we hoping to get in one egg retrieval process. For an egg donor, usually we hope maybe about 20 or so. Definitely we could get a lot more. In a small case in doing your workup to see if you qualify to become a donor, if your numbers are dramatically less, that's good information for you to know as well, because maybe instead of donating your eggs, you might actually want to freeze your own eggs for yourself. So in terms of AMH values, there's definitely a big range. Like we said, they do go down over time. So for someone who's typically in her 20s to younger 30s, the thought is a good AMH would be over 2. Definitely for some women, it might be over 4 or even 5. Sometimes as we get a little higher, we do think a little bit more about something called polycystic ovary syndrome or PCOS. So by checking your specific number, it just gives us a better sense as to how many numbers to expect in terms of the egg count. The one other thing just to be aware for AMH, it is influenced if you're on any type of hormone. So if you're on birth control or if you have a hormonal IUD. So that's something we take into account when we do your testing. If you're currently on hormones, your AMH value might actually look lower than it really is. The good news is none of these hormone treatments actually definitively lower your AMH. It's just while you're on it. So it is something, if you're on birth control, we would have you come off of that to do an egg donation cycle. If you have an IUD in place, typically we're able to have you cycle with that IUD in place.
And Dr. Beck, you had mentioned medications and injections. Can you go into a little bit more detail about the medications that an egg donor would have to inject?
Sure. So the kind of initial medication is typically a very specific birth control, which is kind of helping what we call synchronize the eggs, meaning trying to make sure all of the eggs will grow at the same time. This also enables us for donors that might be traveling from other places to have a little bit more ability to schedule. So that's the first one. So hopefully no major side effects there. And then the real egg freeze medications are for the most part injections. The injections that are getting your eggs to grow are technically your own hormones, just in a different form. So they contain what's called follicle stimulating hormone and luteinizing hormone to try to get those eggs to grow. One typically comes in the form of what we call a pen, where you actually dial the dose. And here, typically we use brands like Gonal-F or Follistim. The other medication you're typically also taking every night during injections is what's called Menopur, which is a mixture of those two hormones. That's one that comes as a powder, and we have you mix it to become an actual solution to inject. For the most part, for your cycle, typically we would add in a third medication, which is called either Cetrotide or Ganirelix, which is something that keeps you from ovulating and keeps your eggs growing together. That's usually somewhere mid during the cycle of injections to keep the eggs growing. And then at the very end, when those eggs are ready, you take what's called a trigger shot, which is a shot that gets the eggs ready to come out. Typically for most egg donors, it does include something called Lupron, which will kind of keep your symptoms a little bit less than if we did not use it. And oftentimes we actually boost that with another little injection of actually pregnancy hormone, HCG, or otherwise sometimes called Ovidrel. So definitely each donor will have a slightly different protocol, but for the most part, it's just the pills and then all of the injections for about 10 or so days.
And will the egg donor have to administer her own injections?
People are sometimes shocked to hear that they actually are usually giving themselves the shots. That being said, they are what we call subcutaneous shots. So if you've ever known someone with diabetes that does insulin injections, it is what we call a little insulin needle. So it's very small, very short, very thin. Definitely not like a huge one in your arm or anything like that. Instead, it's a little tiny one, typically in your belly. We teach you how to do it. We also have videos that you can watch at any time online. Here at HRC, we have a 24/7 emergency answering service. So that very first night of injections, if you're just kind of confused or scared, you can always call. I would say almost all people kind of after that first night actually feel pretty comfortable doing it. And if not the first night, almost for sure by the second night. In a major kind of issue where someone really can't do it themselves, definitely we are more than happy to help teach a friend or family member. Or in the rare case, sometimes there's an option to have a visiting nurse. The issue is the injections is that most of the time we're having you do them at night. And so that's why, unfortunately, we just can't do them for you at the clinic.
So if an egg donor donates her eggs, will she still get her period?
So that's a great question. So basically for that month or so of prep, which is the birth control leading into the injections, we might have a little bit of bleeding when we segue from the birth control to the injections, but not like a true period. And then after the egg retrieval itself, you will get your true period about a week and a half to 2 weeks later. Definitely it might be a little heavier than usual just because of all the hormones, but during the regular part of the process, no, you will not be getting your period. And then the big question is, well, will it affect later, my periods? Will they change? Will they be irregular? Things like that. The answer is no. It's really just during that month that we're doing what we're doing with the hormones, that we're kind of suppressing your own hormones. And then as soon as you get that first period, about a week and a half after your egg retrieval, your periods are pretty much back to normal.
And can an egg donor become pregnant during treatment?
That's another good question. So technically, your body is growing many eggs. So we will say to not have intercourse for the week leading into the egg retrieval procedure, the week after as well. Really, the thought is we're taking all those eggs out during the egg retrieval, but in a very small case, there was an egg that released on its own. There could theoretically be a risk of getting pregnant. So that's why we don't want you to have intercourse. But even more than that, another reason we don't want you to have intercourse is because your eggs have many, many kind of follicles growing in your ovaries. We don't want you to have intercourse because it actually could twist an ovary, which would be an emergency. So for both those reasons, we say no intercourse. So with that type of precautionary kind of lead in, we would say no, there is not really a chance of getting pregnant if you follow the instructions.
Will becoming an egg donor affect a donor's future fertility?
No, the great answer is it does not. Some people are kind of intrigued as to how that is and kind of how do we get all of these eggs in one cycle. So just to explain kind of the life of an egg is basically, like we said a couple questions ago, we are born with all the eggs we have, and over time, unfortunately, the number's going down. Those eggs are essentially in the core of the ovary, and every month, some of them come up to the surface, and that's what we see on the ultrasound. That's what we call that antral follicle count, where we're able to count and kind of see how many we see. In a normal natural cycle, let's say you have 10 on each side for a total of 20. One ovulates out, but the other 19 unfortunately degenerate and go away on their own. So the point of egg freezing is to actually try to get all 20 to grow so we can take them all out and freeze them, and then in egg donation, give them to an intended parent. So that is no impact on your future fertility. It's just kind of using the eggs that would have unfortunately gone away at the end of the month anyway. And then in terms of any other impact on future fertility, again, the risks of the procedure are very, very low. So there should be no risk of scarring or any problems like that would affect your future fertility. Additionally, in going through a cycle, you will learn a little bit more about your own fertility in eggs. So in the very small case, we find that you do have low fertility numbers, or you have a very poor response to medications or whatnot. That actually gives you more insight into your own fertility. And again, in that very small case, we are getting kind of less than we might expect. That actually might give you the information you need to maybe egg freeze for yourself.
And Dr. Becht, can an egg donor still donate her eggs if she had her tubes tied?
That's a great question. Yes, she can. So definitely sometimes all of the different parts of the anatomy, it's a little hard to understand how they kind of interact. But the eggs are in the ovaries. The fallopian tubes are near the ovaries, but really they don't have any impact on an egg donation cycle. Really, we're just getting all of those follicles with the eggs and the ovaries to grow, and then a needle is taking them out. They're not traveling through your fallopian tubes or anything like that. So if your tubes have been tied or you've had other types of surgeries, that would not impact getting the eggs out. In the very rare case you've had like extensive pelvic surgery, that could slightly increase the risk of being an egg donor for doing the procedure. But for just standard tied tubes, tubal, that's totally fine. It would have no impact on an egg-free cycle.
This has been a conversation with Dr. Lisa Becht, a reproductive endocrinologist at HRC Fertility. Dr. Becht, thank you very much for your time.
You are so welcome. It was a pleasure chatting with you all today.
GSHC